Good afternoon and welcome to the webinar Operational Improvement from Real-Time Location Services, RTLS. Thank you everyone for your time today to participate and listen to this. And thank you to TechNation for allowing this opportunity to happen. My name is Paul Schulz. I'm a healthcare consulting manager with Eide Bailly. I was involved with process engineering for a number of years in the manufacturing arena and started my healthcare endeavor in 2006 with a larger regional health system. At that time, we were involved with Lean, and we were doing a significant Lean initiative to improve operations, and it was about 2009, 2010, right in there. We were looking at RTLS and RFID as a way to pull some more information into our understanding of Lean and process improvement, and that started the whole looking into RTLS and what it can do for ambulatory as far as inpatient settings. For the last 4 years, I've been consulting RTLS for various healthcare systems, and just recently focusing on business intelligence and workflow analysis. To the right there is a quote by All True Health System, Jill Wilson. She's thinking about, a real good question here is, what do we invest in as leaders, and how do we make sure that this investment is helping us transform care and help our care providers manage their time and provide a better outcome for our patients? Innovation is a big piece of healthcare systems now. And when I think back to when we were starting Lean, that was a big initiative, 2004, 5, 6, right in there. And going on for a couple of years there afterwards, and it seems like a lot of the lean groups or the engineering groups within healthcare have started to move into innovation teams. So as healthcare moves into this innovation phase, getting some of this real-time operational information is important, and Altru is finding some really good aspects of their investment into RTLS. Let's take a look here just real quick. Let's level set about RTLS systems, and there's two major components. There's the hardware piece and there's the software piece. From the hardware piece, we work with Sonitor quite a bit. There are transmitters, monitors, gateways on the ceiling. They look kind of like smoke detectors. And then there are badges that get affixed to equipment or to people, either staff or patients, and then there are badges that are placed in the room, and all of these different pieces of the hardware work together to identify where items are at, and when we press buttons to help push notifications forward that are developed through the software piece. We work with Zulfly in some instances, and they're a really neat outfit as far as helping us with innovation. They've got, as you can see in the lower right hand there, that's a workflow piece. Software is what collects the data, and it's not just workflows. Asset management is a big piece. Environmental monitoring and understanding the flow of people, equipment, and the status of rooms and what's happening within the organization is a real big piece of the RTLS solution as a whole. There's a couple of things to think about. Some of these things you get a lot of windshield time as a consultant, it seems like, and we've got this downtime to ponder things. And I'm always challenged by such a significant piece of the healthcare system budget is in human capital and in supplies and equipment, and it's not a lot of visibility into those areas, and without that visibility, how do you improve care operations and build knowledge of where some of the barriers are to help those resources be deployed in the best way possible. Together it's 70 to 75% of the budget, yet without much visibility and true knowledge of what's happening, to improve that piece of the budget gets to be kind of challenging. And then the other thing I think a lot about is how complicated healthcare is. I mean, there's all the different aspects of patient care, the different acuity levels, all the staff members and the cultural pieces that are a part of that. There's all the data gathering and working with different technologies within the healthcare system, and all these different components create variation. And variation is always a thorn in the side of productivity. Um, but in some ways, it also helps to drive innovation because of the personal decisions that are made. And sometimes because it's so complicated, we want to figure things out. There's nothing like innovation to get us out of that box. And when we're embarking on improvement, whether it's lean or something else that another program, an organization wants to do, standardization always seems to be at the core of that improvement process. However, we don't want to standardize things so much that we lose that personal choice aspect or that innovation. So where do we find that magic happy medium? Where do we draw those boundaries so we have standardization for productivity and efficiency purposes, but yet we have that personal choice and innovation side. And it's interesting as I work with RTLS more and more. RTLS seems to provide some foundation to that understanding, which I want to cover here in just a little bit. This is really the core of the presentation. These are 5 areas or aspects of RTLS that I think have evolved over time. And those of you in the audience that work with RTLS, this is my opinion. This doesn't come from the Gardner Group or advisory council or anything like that. This is just Paul putting down what I've seen in the last 10 years. And so I encourage the debate of maybe what different words could be, or different order. And thanks to the smart images and PowerPoint, it creates kind of a cool visual, but it's not exactly in linear fashion. A lot of these things are overlaying upon each other. They may be in just a little bit different order, but for the purpose of this presentation, I decided to lay them out this way. So we have location, which I think started the RTLS journey more than workflow. I don't think there's really a lot of argument with that. After location, we started to and wanted to learn more about status. Status led to, okay, this thing is here, and what do we do about it? What's a better way for us to inform each other, which led to notifications. Those 3 elements came together in workflow. Excuse me, which had a lot to do for how we do patient flow in the ambulatory or inpatient settings. And then just recently, data has become a significant piece of the RTLS journey, as just incredible amounts of information are pouring into the systems. And it's important that people have a good visual and are able to consume that data so they can make better decisions and increase their conversations in a way that maybe they have things that they haven't even thought about or considered before. So let's dive into these things a little bit deeper. So asset management, kind of where it started. We wanted to understand where equipment was. There's always a great ROI on the asset management piece. As we reduce and make more accurate our PAR levels, because we know what's going on with the pieces of equipment. As we do that, we can reduce the amount of equipment that we buy, or the amount of leased equipment. We have a tendency with the RTLS system to make equipment purchases or decisions are a little less emotional and more fact-based. when I was with the health system, there was always, we never have pumps where we need them, or, these wheelchairs are always, gone when we need them. There's plenty of pumps and wheelchairs and pieces of equipment. It's just that they always seem to be in the wrong spot at the absolute right time. So with RTLS, we were able to understand where items are, how many are in one location, or how long they have been there, and how often they're used, and all that kind of stuff. And there was a fellow I worked with. He mentioned that location is great, but where we need to go is understanding where items should be before people are even looking for them, and depending on patient status and acuity levels, how many need to be there. And I thought, well, that's rather kind of a big statement for, this is going back probably, 4 or 5 years. How do we get into that, predictive level of things? But it's interesting, with that type of statement put out there in supply chain, that RTLS and the data started to lead to some of those answers. And again, it's nothing that you're going to figure out, right away. But with the information of where equipment is, how long they're there, how often it's being used, where it's moved, all that kind of stuff, you do start to understand how you can develop different par levels and increase your inventory turns in the supply chain arena. Uh, so surprising that once we started looking at individual items, we would see turns of like 1, 2, 3 times a year, and we had set a goal of 15 to 17 turns in order to get a good return on that investment of supplies, and make sure that the supplies are always in fresh status and being used, and the shelf life wasn't challenging us. Pharmaceuticals is a big arena, or is a big concern when it comes to shelf life. And I can't tell you how many truckloads of pharmaceuticals I've seen go out because not understanding shelf life, and for safety, and for really good reasons, quality, we have to get rid of that stock and put in new pharmaceutical supplies. Well, with RTLS, we could better define really what we need for some of that stuff based on a couple of years of it being used, and start to reduce the amount of waste that goes out the door. With asset management, environmental management was just right there behind it, knocking on the door, and we were putting and a number of different RTLS systems do this. Put gauges inside fridges, and we can measure the ambient temperature inside fridges, freezers, in rooms, whether it's a cold room where we have to have different different supplies be at a certain temperature. Um, there's a number of different reports that need to be ran for Joint Commission when it comes to root cause, or how you monitor this type of thing. That RTLS has done a really good job of providing that information. And so with asset management and environmental management, RTLS found its way into the hospital system and was providing some really good return on investment by reducing the amount of equipment needed, helping to decrease stockouts, with monitoring, making sure that we weren't throwing things away, or were able to understand how to engage with systems that probably weren't performing as needed. So there wasn't a big loss of blood or specimens or other items that were in the R&D status. So asset management provided a great deal of operational improvement kind of from the get-go with RTLS. Well, right after asset management and location, you start moving into status. And so there's nothing really as unfortunate as understanding where equipment is, and then you get there and find out that 4 out of the 5 pieces of equipment are not in working order. So that challenge had to be conquered, rather quickly. And it's like, okay, what's the status of these pumps, or of this piece of equipment, or oxygen tanks, or or something else, or powered wheelchairs, or batteries, or whatever it is. And So as that status was starting to get built, well, where else can we do this? And environmental control, there's a lot of statuses there. If the temperature, falls out of range, how long has it been out of range, and what do we need to do about it? Uh, there's a status of people. How long has a patient been in one area, or how long have they been in the clinic or in the inpatient setting overall, or how long have they been in the lobby? Uh, real simple things like how many miles are people walking, or what's the status of a room? Is it clean? Is it ready? Is it need to be turned over, or what's happening? And I think one of the areas where status was kind of most impactful was when we started to understand the different phases of care in the OR, and loved ones could watch the board and understand that uh, a family member or a friend is now in pre-op, and they've been in there for a while and expected to go to the OR at this time, and that makes the satisfaction piece for patients much greater. I know EMRs have that in their systems now, and it's become fairly standard. But going back to when RTLS was kind of getting started, that was kind of new stuff. Bed availability in the hospital is always a good status thing that we need to understand. And status is really when time started to enter the picture. Uh, the time elements began driving more questions about why and when, which was really great. And that's what sort of led to the next piece of the RTLS journey, which is notifications. So we know the location, we know the status, but we should do a better job of letting people know what's going on. And whether we knew it or not, or planned or not, notifications started to make the system more about how people interact with RTLS, and really started to have a bigger impact of patient care at deeper levels. Notifications is when we want to notify, someone when a patient has been waiting in the lobby for, 10 minutes. If a patient is badged and they're sitting there and they've been sitting there for 10 minutes, we can let the reception folks know, or we can let a nurse know that, patient Paul has been waiting here for, a while, and at least we can, interact with that patient, and let them know that someone will be here soon to take care of you. Um, Duress is an important part of notification. Uh, if the button is pressed on the badge for something that I need help now, and that's built into the software side of things. This is a real good example of how software and hardware work together. When that button is pressed, we know that the staff member is in this location of the hospital and they need help, and afterwards we can understand how long it took for people to get there, and provide that type of assistance. Uh, the notifications piece really was an important piece. Excuse me. When we look at how RTLS began integrating with EMRs and other systems, uh, with the notification, or button presses, or automatic notifications of a patient entering a space or whatever, could we start pushing information automatically into the EMR fields, especially when it had to do with timestamps? If a patient is entering the pre-op area at this time, can that time automatically go into the EMR or op time if you're an Epic, because we know that uh, the uh, the badge number that the patient is wearing has been associated with the MRON number, and if there's a timestamp there, can we do that? And the answer is yes. That has been accomplished, and that does happen. It makes the billing process a lot more accurate. It takes a piece of work off of the shoulders of some of the care providers, and it's just a good deal all the way around. Um, and when we start to prepare to meet patient needs via status changes and notifications, uh, this is an important piece as we look at workflow. And so these three pieces that we had in the beginning of location, status, and notification was starting to lead to, well, how can we have really a good understanding of what's happening with the patient when it comes to care overall and workflow. So let's take a look at that. So workflow, the number 4 piece here, I want to revisit this screen of hardware and software because, they always work well and have to work well together in congruency. But the workflow piece is where the staff really starts to get probably more involved with RTLS than with asset management, and and automating, where to go and when, or automating, uh, providing understanding of where the patient is and for how long. It's no more guessing. We know. And in the lower right-hand side there is an example of workflow that was put together by Zulafly, and a lot of different software vendors have similar kind of things. But there's the different colored boxes to identify either milestones or phases of care, and what's going on by color and by the box. It's now we're starting to understand that a provider is needed, or a staff member is needed, or a scheduler is needed, or however it works, and that provides a better service to the patient while saving time in the clinic because we're not opening up doors or getting on the phone or calling down the hallway asking for people. And in the upper right-hand corner is kind of a cool example of that because that shows in this case, a scheduler, knocking on the patient door, and because the scheduler knows that the provider is done, and the provider is, pushed that notification out that scheduler needed. She has an iPad there in front of her that says, patient Paul is in this room, scheduler is needed. So as soon as the provider walks out, she walks in, and that's really a nice piece of the workflow, so the patient can get their appointment scheduled for the next visit without having to, walk out, get in line again for, the reception or registration person. That work wouldn't happen, without RTLS because we've tried to do scheduling with phone calls and pagers, and it really doesn't work very well. So in this case, RTLS has proven to be a real important part of the patient service piece. There's going to be a couple 3 slides here on workflow. There's a lot of if-then statements that reflect the flow of patients for inpatient and the ambulatory areas, and that's to, as you build the workflows, it's like, well, if the patient is in the lobby and when the patient enters the care area, then this type of thing will happen. So a lot of that stuff happens in the background. And when I was talking earlier about standardizing care, this is where the team comes together and says, okay, for most of our patients that walk into this area, this is predominantly what happens, and that creates this standardization. It's not 100%, but like I said, it does create a nice foundation at least of where we want to standardize workflow and how we can get more productive by taking some of those waste buckets out by providing notifications and understanding status of the patient. And and this really is impactful for the care and staff time. We have value throughout the system, meaning we have value when we track assets and we understand room utilization and environmental management. There's great value there. But when we do workflows, it helps us understand the value of time, which I think is incredibly important to the healthcare system. When we first started out the presentation, we're talking about how the budget is impacted greatly by human capital. And so how people use their time, or how the organization can set this up so the use of time by people who are providing care and the patients is utilized in a way that adds benefit to both parties. If we don't have visibility into what's going on, that's just about impossible to to improve and to manage. So RTLS has done just a fantastic job of providing that type of visibility and help us incorporate notification, status, location, and help us understand where bottlenecks are in the processes as well as outliers. So here's an example of data that healthcare systems just did not have a couple, maybe even 3 years ago. We're starting to talk about this thing called cycle time quite a bit. It's the amount of time that the patient is in the care setting area. Some care setting areas want to measure cycle time. That includes lobby. Some do not. They want it to be just when the patient enters the care area, via a door, like into a hallway before they get into a room. And then, when their badge is placed into what we call a drop box, and that ends the process. Well, that's the beginning and the end of that cycle time, which when we first started measuring cycle times in some areas, we were like over an hour long in the clinic. Well, the staff didn't even know that was happening with patients. Well, you as a patient, you know that because you come in for your 2 o'clock appointment and you're not out of the clinic until 3:30 when it's supposed to be a half-hour appointment. So yeah, you know that, but the people who are providing care in the clinic, it's impossible for them to understand or really what the status is of 20 patients that are walking around at one time. So as we started looking at cycle time, we wanted to look at the cycle time as it varied by provider, and as you can see, there was kind of a fairly significant range there, and that raised a really important question of why. Why is this provider's cycle time this much less than another one? And we've all talked about best practice, but this is really when we started talking to different providers about how they do things, and then that level of knowledge was we tried our best to migrate that to the other practices, and over time it worked fairly well, and we were able to reduce cycle time, which gives us added minutes back into the clinic that we could use for patient care. This next slide is kind of cool. It's a RTLS, and we start getting into root cause analysis because we're looking at outliers at this point. And we always have to remember we're not back in 2008 and 9. We're running around with checkboards and clipboards and stopwatches and tracking the patient with the blue sweater on and how long they've been here and there. This system runs all the time. So when we have real-time information all the time, we can look at some of the outliers. And I've noticed in healthcare that when we can address an outlier sooner rather than later, the opportunity to change or improve operations is greatly enhanced. So if we're to engage practice and say, hey, we saw that a patient was in here for like an hour and 20 minutes, what happened? Is there something that we can change or improve so we can get rid of that situation in the future? And when you look at process control or process management, you always want that range of upper limit, lower limit. So we want to, if we want a patient to be, or our goal is to have a patient be in the clinic for about 45 minutes. Our upper limit is 50, and let's say our lower limit is 40, because we don't want to push them through the clinic so fast that they feel rushed. Well, when we pop out of those areas, it's important to engage the people who are providing care and understanding what happened. And it was amazing at it was relatively simple things. The whatever machine wasn't plugged in, it wasn't ready to go, so we had to wait. I had to make extra phone calls for this or that. We didn't have this type of supply, in the area that we needed at the time, and we can change that. Well, this is where management and leadership can really engage the staff on a different level. And what I mean by that is that improvement in the past has been usually through these rapid process improvement events, or RPIWs, or workshops, or whatever the organization wants to call them, and they would get the care team in a room and for the first day, diagnose, what happens with a patient as they flow through the, care area from A to B. And, the wall is covered with sticky notes and, pieces of paper and all sorts of great things to understand, what's happening. And then they would come up with ideas to improve it. The next week they would go out and, do their best to, apply these applications. Well, when we have the real-time system and we were able to look at these outliers and engage the team, the changes would happen fairly fast, which is always, an important piece of engagement and to this culture of continuous improvement. And once it's fixed, it's like, hey, cool, great, that's done. And of course, there would be a few longer-term solutions that we would have to look at, but these outliers were a significant or this outlier understanding was a significant piece of process improvement and reducing cycle time within the clinic. When we, it's interesting that how things are perceived and how things are looked at, and RTLS helps us see things differently. This is 3 appointments in blocks in whatever system it is that you're using, whether it's Cerner or Epic or McKesson or whatever it is. And so when you have a 30-minute block and that is set aside for Bob or Jane or Kelly, that 30-minute block is consumed in the system. So the system sees those 3 blocks as being consumed. They're not available, and it's interesting because that's how the people providing care see the system, is that those 3 blocks are consumed. What we've learned is that there's how RTLS views these blocks is that when they're filled with patients, that there's all these pieces where there's weight and waste. So just that different understanding of what the opportunity is here, how much that waste or that weight can be reduced. Can we go to 20-minute block times compared to 30, or go to 30 instead of 40 or 45 minutes? Can we really do that? And a lot of times it's not that we want to push the patient through, but we want to have the ability to have that patient's time valued as much as possible. We've all gone to clinics and waited. We get back into the room. Hey, cool, I made it back to the room, and then we wait, wondering for when the provider is going to enter the room. Sort of listening for the the knock on the door, steps before the knock on the door. So that's not a satisfier. And when you're a patient on that bottom row, that's really when the provider enters the room. That's what you value. Telling the nurse, what your issues are and, what your medical situation is or whatnot is important. But really what you value is that provider. So in a 30-minute visit, maybe it's only, 10 or 15 minutes that as a patient you really value. So with RTLS, in workflow, there are these things called phases of care or milestones. And we're able to measure each one of those and bringing an understanding of how much time patients are with providers or with schedulers or with nurses or in radiology or in lab. And that's important information when the team gets together and starts discussing what's a better way that we can flow patients, through the ambulatory setting. Again, we're pulling information rather than guessing, we're knowing. And when we can understand ways to reduce that wait time and remove that waste, that can add a significant amount of time back into the clinic, which increases access, which at the end of the day, something that we would all enjoy, or it adds time back into the day for providers to make use to do documentation, which is an expensive part of the day for providers, or take care of other things that are needed for that balance of life kind of situation. So that leads us into RTLS and culture. Challenging the current state can be difficult, but this real-time data, and the fact that it's always there, and it's information that we've tested and we know to be accurate and valuable, is helping us to create conversations we never had before. And I remember walking through the clinic, and I heard a provider, talk to the manager about, their cycle time in the practice, and how it was a little bit higher than he likes it, but uh, the his cycle time mean in the morning was different than the afternoon. So what can we do in the afternoon to decrease wait time for the patient? I was blown away, and that was another one of those short improvement conversations that happened kind of almost spur of the moment, because the data was right in front of people and they could look at it and they could start asking questions and moving into that improvement piece fairly quickly with the leadership of the clinic. And so that creates a culture of improvement. It creates a culture of innovation, rather than just hoping today was kind of a bad day and hoping that tomorrow is going to be better by something magical that happens in the universe. But so having that information, these are really smart people who are providing care for people all over the country. And all of you, given the data, will come up with some really cool ideas in order to make things better. But you need to have that data. I feel strongly that that information is necessary, whether you're working in supply chain or you're trying to figure out how to manage your transportation team within the hospital, or you're trying to understand utilization rate of rooms, or you're trying to figure out how to increase access in the ambulatory setting. That data is very important. And going back to the quote that All True Health System had about where to invest so that we can create innovation and that transformation of care, in my opinion, and I've been, I've been doing this and I work with it a lot, but I think RTLS has had a significant impact on that understanding of operations. So that can provide improvement. So putting badges on staff, that always seems to be a fearful thing of some folks, but it's interesting when the data is brought back and we can show how their day can be better, the patient's day can be better, operations of the clinic can improve overall, or the ED or the OR, or kind of wherever it is. They see value in that, and really it's just a badge, and we're just, you don't have to do much with it. Just understand that that information that it's pulling is going to help, and when we know where those bottlenecks are affecting patient care, that does take a priority for people, and they soon forget that the badge that they're wearing is doing something that hasn't been a part of their life in the previous years that they've worked there. But that seems to go away fairly fast. I'm just mentioning that because some of you may be thinking, well, I'd like to do this, but badging people is something that everyone has resisted. But honestly, with your phone, I mean, everyone knows where everyone's at. As soon as you sign into the EMR, we know where you're at. So location of people is everywhere all around us, kind of anyway. And again, pulling that data is significantly impacting, again, operations and care. So the last piece is data. As we do these different elements, we're pulling a lot of information. And one of the areas I want you to think about with this, data being the new oil, is what is it that's pulling data? And this is BI. This is what I consider, this pipeline going into the ground and pulling data is your business intelligence tools, and being able to present information to people that they understand is really important. So let's take a look at a BI tool. Here we have a lot of different pieces of information. We're looking at wait time, across the different practices. We're looking at patient value added time. We're looking at cycle time. We're looking at on-time start. We're looking at starts within the first 15 minutes. You know, when you look at this real quick, you can get a really good understanding of operationally what's happening with the clinic. And as far as I'm concerned, this has been a big step forward for clinic operations, for RTLS, for leaders, especially as we want to start driving these different conversations. We need data to have innovation. We need innovation to transform care. And we need to transform care. Otherwise, we're going to price ourselves, out of this market, and other people are going to start entering into the arena that can do a better job of seeing patients at maybe a lower cost. What I'm talking about are the Walmarts, the CVS pharmacies, the Targets, Minute Care, Minute Care, those type of operations. Retail primary care started up, I think, somewhere in the neighborhood of 2012, and since then it's had, every year adding about 20% or pulling about 20% of the available dollars out of markets, because consumers are choosing to go that route because they know they can get in, they know that they're going to get taken care of, and they know that they're going to be there for a relatively short period of time. So as this challenge becomes more predominant in our marketplace, we have to manage time and we have to manage the outcome, and we can't burn our staff out at the same time just by asking them to work harder. So workflow and the advent of business intelligence and pulling that data forward is really important as we move forward in this business intelligence arena. I could talk about this BI tool seriously for about a half hour of the important things that it's done, the how it's affected patient or providers' practices, how they view things a lot differently, how they work with their team as far as understanding patient flow. We've moved out of the finger pointing business and into the business of growing knowledge about how the process works and how all of us can participate, to make that better. I think data has done a lot to level the playing field. I think it's done a lot to reduce the drama within clinics, and I think that type of information has been very helpful. Again, as we look at reducing cycle time and adding those minutes back into the clinic brings the opportunity for us to balance our lives as care providers or to open up our access, for more patients. Minutes matter. It's as you look back, or even current day, we start looking at standards like hours per patient day or patients per provider day or something like that. When those standards are placed out there as a productivity number, staff have a hard time understanding what that means to them. But when we start talking to them about patient value added time, the amount of time that the patient is a clinic, and the number of minutes that the patient is with somebody getting care compared to the overall minutes that they're there, that resonates with them. And we're finding best practices out there. We have some practices where the patient value added time is over 80%. And we have a lot of practices where the patient value added time is under 50. Well, that's a big swing. So in there is best practice. How can we learn from those that are doing a really great job, and how do we apply that learning into different practices? And that type of visibility, as practices start applying some of the things that they've learned, they want to know, okay, how am I doing? And the RTLS system provides that feedback in real time or within minutes to help them understand what impact the changes have had. And because that impact is understood, we have the ability to make that sustainable, which is really key when we look at the ambulatory or the inpatient arenas. It's real expensive to do improvement efforts and then not have them stick. And so these new numbers that are floating around, cycle time, patient value added time, provider value added time. Um, these are becoming, larger components of the health systems that we're working with as they look at how they budget resources and and where they need to go to improve operations. So that's been really fun to see. So here we are at the end. We've talked about location, status, notifications, workflow, and data. That's been kind of an RTLS journey. All through the journey, we've been adding value to the organization and providing improvement, whether it's understanding where assets are, if it's understanding, the environmental status of freezers or temps or cold rooms or OR rooms, whatever it is. Um, the status of, is the room available or not, or where's the patient, or is this piece of equipment, available to use? Notifications to, provider needed or staff needed. Designing workflow has helped with standardization, which is always helpful with the improvement efforts. And but yet we want to keep that personal choice and decision, element in there. And now with data, uh, feeding a lot of this information back into the care area to allow teams to make better decisions and have conversations, which never would have happened a few years ago. These are all big things for the healthcare system. And so where do we invest? We need to invest in our people. We need to give them the information that they need. We need to give them data that maybe wasn't available before, and for that reason it was really hard to make decisions. Um, by no means is this journey over. I think RTLS is just going to continue to find ways to provide information to those that are providing that are doing care, and it's just like technology does. It's going to get smaller and faster and less expensive. So I look forward to the coming years of RTLS and and where this can go. And at the end of the day, it's leaders that make these decisions, and um, we need leaders that can step out, that they know where to invest, start knowing, find the data, stop guessing. That's probably the biggest thing. And mobilizing your data, through a process where your team can get the information or views out of the RTLS system via reports or some other system like BI where the information makes sense to them and they can do something different. And with that, you can grow the capacity of your teams and be competitive in your marketplace. So thank you very much for your time. I hope you have been able to pull from this some good ideas, and I look forward to answer your questions, and take care, everyone. Thank you very much.